Have you ever wondered how life-saving resources like organ transplants or expensive medications are distributed when there simply isn't enough for everyone? It is a complex challenge that societies face, requiring careful consideration of fairness and ethical principles. Distributive justice in healthcare allocation refers to the ethical principle of ensuring fair and equitable distribution of healthcare resources among different individuals or groups within a society. It addresses the fundamental question of who gets what, when, and why, especially when resources are scarce. The core mechanism behind distributive justice lies in various ethical theories that attempt to define fairness. These theories provide frameworks for making difficult allocation decisions by considering factors such as equality, need, contribution, and utility. For instance, an egalitarian approach would prioritize equal access for all, while a utilitarian approach might seek to maximize overall societal benefit. The why of these decisions is rooted in the belief that healthcare is a fundamental good or right, and its distribution should reflect societal values. Practically applying distributive justice involves establishing transparent criteria and processes for resource allocation. This means developing guidelines for prioritizing patients based on factors like medical need, prognosis, age, or even the potential for future life years gained. For example, in organ transplantation, complex algorithms often weigh factors like medical urgency, blood type compatibility, and waitlist time to ensure a fair system. One insider detail to understand is the concept of a fair innings argument, which suggests that everyone deserves a certain minimum amount of healthy life, and prioritizing those who have not yet reached this threshold might be considered just. Another important term is QALY, or Quality Adjusted Life Year, which is a metric often used to assess the value of medical interventions by combining quantity and quality of life gained. These sophisticated tools help ethicists and policymakers navigate extremely difficult choices. Understanding distributive justice in healthcare equips you to critically evaluate how our societies make crucial decisions about who receives care. It illuminates the ethical underpinnings of health policy and encourages thoughtful consideration of what it truly means to allocate resources fairly, ultimately aiming for a more just and healthy community for everyone.